And while you were in your MPH program, you had roles as a graduate assistant at UNC Greensboro and a prevention intern at Children's Home Society of North Carolina. Tell us a little bit about those experiences.
Yeah, so while I was in grad school, I did have a graduate assistantship where I worked in the Dean of Students office, where I was a sexual violence campus advocate. And so what that looked like was being able to connect with different entities around the university, so connecting with different organizations and different departments within the university to do trainings, to talk to them about, sexual violence sort of prevention and how to identify the signs of sexual violence and how to support students when they experience sexual violence. We know that that is not unfortunately, that's one of those things that's kind of like, like when you talk about universities and talk about colleges, sexual violence comes up a lot. There's two factions of that. There are folks who are the perpetrator, and there are folks who are the victims in that regard. And so there's this idea of who each of these people are, and so it is really good about being able to educate like who these folks are, but also like what leads to these kind of things and how to identify what this looks like before it even happens. And then it's like when it does happen, how do you even support that? One of the things about working in the Dean of Students office as it relates to that is that kind of represented sort of this sort of like judiciary space, meaning that when these types of things actually came up on campus, folks were essentially tried. They were tried, the perpetrators were tried or whatever. And that also meant that there was a certain degree of support that they needed to be able to understand how to navigate that system and to be able to better understand like what happened and what went wrong and, why they're even in this space. So it was a very intense role, particularly for a young graduate student, but it was something that was worthwhile in understanding those different perspectives. And so I also did an internship at the Children's Home Society of North Carolina, where I got to work on a team where my main responsibility was to develop sort of this curriculum to be able to support folks who were substance users, but people who formerly used substances who were also within the foster care system. So the thing about it was just recognizing that in the foster care system at 18, a lot of times folks, they're on their own, and realizing that there's a need for a lot of independent living skills that people just don't learn along the way. So it came from a place of, again, prevention and how to ensure that these people who were recently released from the foster care system, that they were not ending up in situations where they were just not doing well for themselves, meaning like they had access to, different services as they needed them. They had access to jobs, access to trainings, and even just access to like day-to-day living skills. So yeah, it was a really interesting experience above all. And that was one of those things when I got to Children's Home Society that I didn't even know that they focused on. I actually went there originally to get trained on a curriculum that they had, which was called Wise Guys, which was based on like teen pregnancy prevention, but through the lens of teenage men. So that was actually my initial interest in working with them. And so I got to do a little bit of work with Wise Guys, but I ultimately ended up doing the foster care work.
Yeah, that's fascinating. And yeah, well, I'm glad that you're able to dig deep into those topics as well. And were you a research associate at UNC Chapel Hill before you graduated, and then an associate program manager after you graduated? Is that how it worked out?
So how it worked out was I started off working as a research assistant. So I was just in the clinic and just focused on like doing the interviews and working with folks. But just not too long into that role, I was able to, and I actually finished my master's degree program. I was able to get the promotion to the research associate role. So working more closely with the PI and preparing, reports and getting everything together for our funder. So that was sort of the scale up after things changed. And even in that space, I was really happy because I was super supported by my former leader who, she ended up leaving. She was, a public health professional as well, but she wanted to go on to go to a PA school. She wanted to be a physician assistant. So she left and did something else. And she said, this project is in good hands with you. And she was able to hand it over to me. And that's how that happened.
Okay. Well, thank you. And I'll ask you a question about a little bit more about what you did on that project in a bit. But before that, I wanted to ask if there were any big masses of public health takeaways that you wanted to share with us.
Yeah, no, I mean, if whoever's listening, if you're thinking about doing it or you question doing it, I say go for it. And I say go for it and do it in a way. I know there's so many different ways to access your education nowadays, but I would say to the best of your ability, do it like in a classroom setting, do it in a face-to-face setting, because the experiences that you get are just so, I don't know, they're just so robust, I guess, for lack of better words. I was glad to be, trained and educated by a group of people who were very experienced, particularly in like community-based approaches to doing this work. So it's, and I think it required me to like even change my understanding of what my MPH program was going to be like. I thought I was going to go in and we were going to talk about specific topics and, try to like, learn those things. But really it became more about like understanding those skills that are necessary. And some of those skills are so, I guess, practical, meaning that like you can't really learn them and embrace them without doing them. So, being able to be guided by people who've done the work, who've been in some of the most marginalized communities. And when I say that, I mean, at least in my experience, the most marginalized communities, even in America, right? So a lot of people have some transferable skills from working on Peace Corps or working in other global environments, but having someone who's telling you about their experiences of working in, East Baltimore at the height of the crack epidemic, just is a different experience. And it really it frames how you go on to be a practitioner as well moving forward. So that's my nugget. If you can do it in front of people, in front of a professors, like do it in a face-to-face environment, and be very critical about who you're choosing to educate you and to help you guide your way through your public health journey.
Yeah, absolutely. Definitely has to be an intentional decision and a lot of thought into that process, but it could definitely be very, very rewarding. That's for sure.